Now we're live. Yes.
There we go. Very good. Guess we can give it a few more minutes, maybe a minute or two.
Kevin, we're on live, so I think we probably should go ahead and get started.
Okay. Well, thank you, Paul. And thank you for everyone who has shown up. Hope everyone had a great 4th of July weekend. We're halfway through 2021. I can't believe it. We're halfway. We're on the home stretch, middle of the summer. So hopefully everybody's having a good summer, had a good 4th. The mayor has asked if I would chair this committee throughout the rest of the year, at least. So I hope everybody's okay with that. I told him I would, and I am honored to do so. And I appreciate everybody's time on this committee and everybody coming in, and appreciate your expertise and what you share. As I've said before, it certainly helps the city make great decisions, and we appreciate the work that you do. So we had minutes that were sent out on Tuesday, yesterday, I guess, and hope everybody got that. Do I have a motion to approve those minutes?
Motion to approve.
And a second.
Second.
Okay, so those minutes, there's been a motion to approve those in a second. All in favor, please say aye. Aye.
Aye.
Opposed? All right.
Aye.
Thank you very much. Let's see, is Katie Richardson on yet? I don't know that she is. All right, we'll give that a few minutes. Let's see who else is on. I tell you what, why don't we slide down to the Health and All Policies Task Group update, because I do see Susan on here, and maybe we can start from there and we'll kind of work backwards on our agenda then, if you don't mind. Is that okay with you, Paul?
And Kevin, yes, that's going to be in 2 parts, because we do have Chloe Stewart's going to come on, Susan, a little bit right after 9:30 when she's finished the meeting, and just give us an update on the city plan. So and with that, I'll just let Susan maybe talk about this, because this Health and All Policies has been, the city plan was one part. Now it's been working on the grant, and Susan's just been trying to tie all the strings together. So Susan, you want to add anything?
No, I mean, I think, Paul, you did a good job of summarizing the focus of our committee, our subcommittee. Initially, our focus, as we requested in the document that was approved by City Council back in the early spring, was that we would initiate a health and all policies strategy with the city plan. So we have been engaging with Robbie and the city planning group and providing some recommendations. And I think we'll have an opportunity to review the draft that's going to City Council this month, and make sure that we have the right wording to make sure that health and all policies is represented in that document. So we can wait and kind of answer or ask any questions further on in the agenda. And then the other piece of it, as Paul said, Dr. Richardson brought forward to our committee an opportunity to apply for a grant through the CDC. And we were very fortunate to have our partners from Healthy Tri-County and Trident United Way step forward. And the timing was great, because our city grant writer was going out on maternity leave, and we knew that we needed to have someone kind of take the lead on preparing that proposal. So, I think, I don't know, Paul, if you have somebody else that wanted to speak specifically to that proposal or the process. I'm happy to provide an overview, or are we going to do a deeper dive?
we could go ahead and do a deeper dive on. I'm gonna pull up just a little bit of the of what the outcomes that we were working on. I think I've got it. Let me double check. Can y'all see the narrative? Is that what do you? I'm not sure what you might be able to see.
Yeah, we can see policy narrative.pdf, the outcomes, strategies, activities, that page.
Okay, so you see where it says is outcomes on the screen right now?
Yes,
Yep.
sir.
I thought that's probably the best place to start. Yeah, what we looked at in developing this is that we have a strong leadership team in place with this Health and Wellness Advisory Committee to help us get started on the process. Now, we do know if we're awarded the grant, it will be engaging community members from the grassroots on with the whole process. But with all the players we have at this table, we should be able to bring a lot of great leadership into the fold of it all. So over the main things I wanted to emphasize is over the 12-month period here, we hope to look at this to build what they call an accelerator plan that will take us 12 months to look at, where we look at the built environment and food insecurity and nutrition, and we will build a plan not only with what we have available through our leadership group, but mainly how a plan that we can sustain in that community and use in other communities. And while we focus on the neck area at 29405, we realize 29403 has a lot of that area goes deep into 29403. So we're looking at that area as a whole to try to address these social determinants of health, and that's what this plan was really built on, was to talk about how we'd bring that leadership group together and what we'd be focusing on to try to really to dig deep into it. And we do have Joey Curran on. Joey was one of the authors of the narrative that helped pull it all together from all of our discussions. And so, Joey, you want to dive in?
I certainly can, Paul. You gave a great overview. I'm just very excited about this opportunity that this group will have, because it's a great opportunity for us to really put a plan together to systematically address some of these health social determinants of health within a specific zip code, right? So we've talked in this group several times about the disparities in life expectancy that we see across the city's zip codes. And this is our one of the strategies, I think, that is a strong way for us to tackle those. And that is to put together a plan, put together a team of interdisciplinary folks and folks from the communities that we're looking to serve to help, address, again, the two big social determinants of health this grant will help us work towards is the nutrition and the food desert aspect of these communities, as well as the built environment and the physical activity opportunities that folks have. And that was strategic, because we know that the city can play a very strong part in helping to develop those components through its transportation opportunities and through its just various levers that the city is able to pull. And so very excited for us to get to work on this. And it will be the first step, and I'm sure many, many steps towards our work to address those disparities in life expectancy.
Yeah, and I think it's important to add, we in part of it, we showed the organizational chart of the entire city, because the city has got a lot of plans that have been working, from transportation to regional planning, to transportation, to looking at the housing of building new housing units in that area. And I mean, it's just, there's so many components that this is the opportunity to take those components and look at them of how they relate specifically to the built environment, how they relate to that food insecurity, and how do we make sure that all those threads that are going on are working in that same direction, that we're all pulling the pieces together to create that pathway to a successful connection to really open up opportunity in these areas to try to knock down some of these social determinants. So it's just it's a great opportunity for us. We know we're going to be, they're only giving out 20 awards of 125,000 around the nation, and they got spread them out equally among different groups. But we got a great team here, and I hope that they will take some look at our team and some of our expertise. And Dr. Richardson was there helping plug in. We've connected with 2 different CDC programs that have been being run through the state to give us good partners. That Mayor signed a letter with the one for the block grants, and Katie can maybe elaborate on what that all does. But it just shows that we've got partnerships built here and a way to make a difference. And you know, even if we don't get this grant, we have now planted some grassroots opportunity there that could potentially we could develop into something further. So Katie, Susan, either y'all want to jump in?
No, I agree with what you and Joey both said. I think, I hope we have a strong application. I do think we have a lot of the foundation built. And so we'll see in September, but I hope with or without the money, we will find a way to make it happen.
Thank you. And Dr. Susan Johnson, you have anything further to add on the grant?
No, I just want to thank the team for pulling it together. That was a pretty quick turnaround, as you can imagine. So we really appreciate the support from Joey and Renee, kind of taking the lead on that. We will find out in September, but I think, you know, as Paul and Katie alluded to, even if we don't win this particular grant, that we've put the work in, and I think, you know, once we find out either way, we would want to look for other opportunities for funding to support our efforts in this area.
Yeah, thank you to everybody for all your work on that. Outstanding, and hopefully we get this thing. So thank you. I guess we will jump back up to community health update. If Dr. Katie Richardson's ready, we'll go there.
Sure. So Paul gave me 3 minutes to discuss 4 topics. So I'm gonna go very quickly. I first want to publicly thank the mayor, who I think is on the call, but he joined us and led us in an event on Friday, June the 25th, in the council chamber. I think it was one of the first events back in the chamber since the COVID pandemic. And basically we gathered to commemorate the 40th anniversary of the first cases of HIV here in the US, and to encourage people to get HIV testing for National HIV Testing Day, which was June the 27th. And for the mayor and partners, including Better was there, Trident United Way was there, Palmetto Community Care, DHEC, MUSC, Ryan White Wellness Center, the city of Charleston. I'm sure I'm leaving out others, but all to speak about U equals U. And I think I've spoken about that with this group before, but that's the undetectable equals untransmittable. So for those who are living with HIV, who are on their medications and have an undetectable viral load, they are not able to transmit the HIV virus to their sexual partners. And we believe that this has a lot of potential for decreasing stigma in our communities around those towards with HIV. So several news outlets were there, and the mayor really made a personal plea for an increase in HIV testing, as well as relinkage to care for those who know they have HIV but have fallen out of care, and then the importance of U equals U for our community. So I wanted to start with that. I did want to say that I and others at DHEC and the CDC do have concerns with the Delta variant. I think in the past day or so, it has now become the dominant strain across the United States. We still do not have many sort of cases officially on our dashboard in South Carolina, but that's just because we are still not sequencing very many of the cases that are being diagnosed. But what we do know is that the variant doubled in a week in South Carolina of those cases that we are sequencing. So the good news is that we believe that the vaccines, all three, continue to be effective against this variant. But what we also know is that this variant is much more transmittable. So it's more infectious. And therefore, for those who are unvaccinated, this becomes a time where we are at risk for a surge or an increase, especially after the July 4th weekend. We are still at less than 50%. 43% to be exact of our South Carolina population that's eligible has been fully vaccinated at this point, and that is just too low. Missouri and other areas in the U.S. with similar vaccination rates are seeing significant increases, not just in infections, but also in hospitalizations. And so we are working hard and would appreciate any help that all of you can give us to help us with your friends and family, as well as the community at large, to help to move those who are still contemplating the vaccine, but have not yet decided that it is time to move towards being ready and receiving the vaccine, any of the three available. Also, if they've only received one vaccine of the Pfizer or the Moderna, it is very important to get the second. So one thing about the Delta variant is it is significantly more effective against the Delta variant when someone is fully vaccinated. So they have both doses. For instance, Pfizer is only 33% effective with one dose against the variant, but 88% effective, and this against symptomatic infections with both doses. And so that is a significant difference. And we do have a significant group here in South Carolina who's received one dose of a 2-dose vaccine that has not completed the series. And then I'm going to finish just talking about schools. And I see Maggie is on, and the school district has been doing a great job working with us, and Ellen Nitz and the nursing team there themselves have worked hard to vaccinate not only teachers, but then sort of the 16 to 17-year-olds, and then another group of 12 and over prior to school being let out. We do believe that there will not be mass mandates in the fall for K through 12 schools, both from the governor's mandate back in May, as well as a proviso that the legislature has passed. DHEC continues to believe that it is important for kids who are not vaccinated, as well as others in the school community, to wear masks. And then obviously to get those who are eligible vaccinated as soon as possible. It does take 5 weeks total to be fully vaccinated with Pfizer. And so now is really that time for kids and staff in our school communities to get vaccinated so that they will be fully vaccinated by the time that school starts. And finally, we are awaiting the CDC. We do believe that they will sort of revise or at least review their guidance for schools over the summer. And we at DHEC are waiting for them to come out with that revised guidance prior to us sort of reviewing our guidance for the fall. I know that's a tight timeline for the schools since we have a shortened summer, but we are here, and that's the end of my update. Sorry, it was a little more than 4 minutes, but happy to take any questions.
Paul?
A couple of questions. In the 43% South Carolina vaccinated, is there any particular age group that we need to try to help target? Is it the older ones seem to be at a higher percentage, but what can we do in those different age groups?
Yeah, great question. So it is sort of the 20 to 29, and I think more specifically, probably the 20 to 24 age group that is the least likely to be vaccinated at this point in time. So there is room for improvement in all age groups. Our sort of oldest age groups are the most vaccinated, thankfully. But for sure, those sort of young people, I think, is the group that if we're targeting, just one age, those sort of college into adulthood, that we most need to try to reach.
What about the school age children, 12 to 16? How are they done on the vaccine? Have we got a good number of them vaccinated?
We don't have as many as we would like. The school district, I don't have the numbers in front of me. I think Maggie, they felt like they reached about 10% of the students, maybe in that 12 to 15 age group, but maybe Maggie can get it a little closer. And we believe that the numbers are, I don't have it in front of me, but more like in the 20 to 30% range, at least for Charleston County, which is one of the counties with the highest vaccination rates for that age group. But we still have a long way to go. We don't believe that's anywhere near where we need to be to make sure that our kids are safe when they return to school in person this fall. Maggie, do you have better numbers than what I remember from Ellen?
Sure. So I'm actually just pulling up a report so I can speak a little more accurately, but I do believe in our superintendent's update at last Monday's board meeting that we had in the 12-year-old and older vaccination, 7 regional sites that we did, we administered 631 first doses and 475 second. So total number of doses for all ages and for student vaccinations were 848 and 741 respectively. So I don't know off the top of my head what percentage that comprises of our students that would be eligible within that range. I mean, that's pretty much all middle and high schoolers. So 10% may be accurate based on it only being 848.
I'm going to go back one more question, and then I'll hush up for a few seconds. But in the Delta 33%, 88, and you said only one. A lot of people have only gotten one shot. Does the time limit still apply that if they got the one and it's gone beyond the 42 days, that they're going to have to start the whole process over again?
No, fortunately, that is not a recommendation. There's no time limit at this point in time for getting that second dose. So there's no reason that anyone will need to start over with that first vaccine. We do believe that we have data to show that within those 42 days, but I think increasingly as we see people get that second dose, even outside of that 42 days, we believe it will still be an effective sort of fully vaccinated series, even if it is past that 40 days when the second is administered. So even if you haven't gotten the second dose and it's been even a couple of months, please please go get it. And it should then fully protect you against any of the variants currently in South Carolina.
Joey?
Hey, Dr. Richardson, just a quick question. If you have any news or any insights around whether or not you suspect that an annual booster will be needed for COVID?
That's a great question, and one that we are hearing increasingly. There is, at this point in time, we are not preparing for a booster. So as far as people have been followed out from their fully 1 or 2 dose series, depending on the vaccine, most continue to have high levels of antibodies. And so it may be that as the variants continue to mutate or the virus continues to mutate, there may need to be a sort of version 2.0, and all of the vaccine manufacturers are working on that. But we are not yet at that place, given the Delta variant. It is still susceptible, or the vaccines do still protect against the Delta variant. So I think likely at some point we will need a booster, but that's not at a year, or, we just don't know when that will be yet. We'll continue to follow, and we won't recommend that until we feel like people need it.
Any other questions for Dr. Richardson or for Maggie? Well, thank you very much for that report. We appreciate it. Thank you so much. We'll move on to number 4 on our agenda. And I do see that Kim Butler Willis is with us to give us a report from the Health Disparities Environmental Justice Subcommittee, the Special Commission on Equity, Inclusion, and Racial Conciliation. And if you would, please give us an update, Kim. Thank you so much.
Not a problem, and apologies for being late. So there are no updates. We are still exactly where we were the last time we met. And as more information becomes available, I'll be sure to share it with Paul, and I'll bring it to this meeting, but still under review and still searching for that consultant. Any questions about that commission?
Kim, is there anything we should be working with to help you in any direction?
No, you can actually, so Paul sits on that committee with me, and so does Renee and anyone else on this call. So Renee from Trident United Way. So nothing right now. We've already done the heavy lift, and that's to get the recommendations over to Amber. Amber Johnson is the manager at the city. And so now it's up to the city. So once that comes back to us with any potential edits or even consultation with the consultant that's chosen, then we should have more work to do. But I can share out those recommendations if, Paul, I can send them to you to send out to the team just to make sure that everyone knows what was indeed recommended to City Council.
I think that's important because you really tackled 2 things: health disparities, and you also tackled environmental justice. And so there was some discussion in the resiliency part, and as well as looking at some of the same items we addressed in this grant that we just wrote. So I think it's important. So if you send it out, make sure it gets out to everybody.
Okay, thank you, Kim. Appreciate it. I don't believe Chloe's on yet. Chloe Stuber, are you on yet? I don't believe so.
She's not on yet.
All right, then if it's okay, we may go to the heat watch update and give Dr. Susan Johnson a chance to talk to us about the heat watch.
Sure. I did send a handout for volunteers and FAQ to Paul. So Paul, if you, I don't know if you can pull it up, and if not, if we can just send that out to the group. But I have shared with this committee that our Carolina's Heat Health Coalition, and specifically some partners in Charleston applied for and won the opportunity to participate in the NOAA Heat Watch, along with 21 other cities across the country. So we have been working with our local NOAA folks to determine the best day, because there is a 1-day data collection as part of the study. And we want to make sure that we are looking at weather, and we want to try and have that day be one that is reflective of the heat that we experience in Charleston in the summer. We're also being very strategic about the routes of data collection. We want to make sure that we are capturing data in places where we potentially could implement some strategies to mitigate the effects of heat. So what we're looking for right now are volunteers. We need 20 teams and we only have 7 right now. We thought we were going to have a lot of students to help, and unfortunately that doesn't look like it's going to happen. Our target date is on a Saturday, July 31st, but we kind of have left that week open just in case we end up with a tropical storm or something else that we will need to move. But it basically, to volunteer, this handout, it describes it. It's a commitment of 3 hours of driving or riding in a car with the device that is, you can see in that picture that is provided by NOAA. So that is attached to the passenger window. You can either be the navigator and sit on the passenger side or driver. And each team will have a set route that they will drive through 3 times that day. So we're kind of targeting a morning, kind of a late afternoon and an evening route. And you would be driving that same route. And there are some, once the volunteer signs up, they will be able to see what the routes that are available and select the one that is most convenient for them. And then we will also require training, but it will be in a webinar. So volunteers can do that at on their own time. But it's a really great opportunity to engage in this national kind of citizen science study. And so I would just ask that if you are not available, that you share it with your folks to see if we can secure those volunteers.
And maybe city council can announce it at the next meeting, to their meeting, to put it out on their agenda too, to just let people know about it as well too. So I know the mayor had said he would be willing to do that, and Kevin and Mike are there to help you. So
that would be great. We do need to have everyone, the volunteers, nailed down, or our goal is to have them confirmed by the 19th of July. So if we can get that out as quickly as possible, that would be great.
Okay, very good. Well, thank you for your work on that. And any questions for Susan? Okay.
I posted a question, but it's just a curiosity. Susan, do you know if there's any reason why these couldn't be attached to like any of our city buses that are running routes within the city? Is that a possibility, or would that not make sense based on how the research is needed to be conducted?
Basically, the protocol is very specific because they're trying to, like I say, we have a cohort of 22 cities, and it needs to be consistent across the board. So, I mean, there are some other things that need to go into it as far as the specific route, the timing. There are places where we want to make sure that we stop. So, a lot of the things that we've talked about previously, bus stops and some other areas of interest. But it's very controlled in terms of the protocol. And I think that a bus would not fit that protocol, unfortunately. Not to say that's a great idea. And we do have some other research studies going on. So we've got the wet globe research. So I think, we could certainly consider that for a future study.
Very good. Seeing no other questions. Thank you, Susan, for that report. And I'll kind of move into community update for now. I know that Jennifer Roberts wanted to give us an update.
Yeah, thank you. Good morning, everyone. I do have a couple updates. One of them, I don't have all the information, but I hope to get it soon to share it with the group. One thing I just wanted to share with y'all, I don't know if you saw the press conference, I think it was last week, that was formally announced that we're part of Consolidated Dispatch Charleston 911. So we have a mental health counselor working in there, and they're passing mental health calls to our person. She's a mobile crisis team member. So the hope is to reduce the resources that are being called out for mental health calls, maybe not even having to have anyone go out, or maybe just mobile crisis and law enforcement. So we've been there since, I think, the beginning of October, and just trying to get the data right and get everything right and figure out what was happening. Dispatch wanted to wait to make the announcement, but it's a neat program. We modeled it after Houston, Texas, and we hope to continue to grow it and make it 24/7. It's only during the weekdays right now. I did want to remind everyone about our conference. This is the last time I can remind you, because it is at the end of this month. Oh, thank you, Paul. I noticed the heat. One of the days is on one of the hottest days of the year is July 31st. That's good to know, right after the conference. We are having this at the Gilliard on the 28th through the 30th. So if anyone's interested in coming, we have really great speakers. And I wanted to mention that Mayor Tecklenburg will be welcoming everyone at the conference the first day. And lastly, I want to share, this is the part I don't have all the information on, but it's a really neat opportunity for the community. So mental health got a grant called Communities of Care, and we're going to be offering trauma-informed suicide prevention training and for train the trainers. And we're looking for community interest for anyone, hospitals. We have a North Charleston Fire Department doing it right now. There's a 90-minute virtual training called Start, and I can't give you any more information because I barely got a teeny bit this week myself. But we have, it's an online virtual presentation. 200 licenses will be available for Charleston County. 10 licenses will be available for the faith community. We've got lots of books. They're called Gizmo books, and there'll be in English and Spanish that we'll be able to give out to libraries or schools on how to recognize suicide. So that's all the information I had. I tried to get a flyer from them by today, but they're developing it now up at DMH. But it sounds like a nice opportunity for any kind of groups, agencies, organizations that would like to learn more about recognizing symptoms of suicide and what to do. So I'll send Paul more information as I get it. But we do have a lot of licenses ready to go as soon as we're ready to take off, I think within the next few weeks. So if you are interested in testing it out, checking it out, let me know. And that's all I have for today.
Thank you for those updates. We appreciate it. Any questions for Jennifer Roberts? Okay. Is Lori Yarborough on the line by chance?
Kevin, since you're on that steering committee, maybe you could give an update.
Caught me off guard there, Paul. Oh man, I'm just not prepared to give a report right now.
Well, we know they're wrapping up the Park and Recreation report, and it's expected to be at City Council in August for review. That they're working on now. A little bit more details on the nuts and bolts of exactly all that discussion and big plans. What are the nuts and bolts, and they're just working on all those small details for the next couple of days. I think they're in town working on it, and but they should have a report to City Council in August, and once we get a link to it, we'll be glad to share it with everybody so that you can just see those connections that are going on.
Yeah. Okay, great. All right. Did Chloe happen to come on?
She hasn't yet, but can we just do a go around and just go to each and see what we're doing in our different agencies? Because I know Federer's been very active with different items, as well as Low Country Food Bank. And Nick, one day we want to have you do a little presentation at our meeting, just to give us a little update of the food bank, and specifically all these food deserts and all the good work y'all are doing and how we connect with them. So we'll get that in the future, but maybe we could just do a little go around and just see what everybody's up to.
Okay, very good. Do we want to start off with Feder? Are you there?
Yes, I'm here. Good morning.
Good morning.
So we are partnering with Low Country Food Bank. We have a partnership with them in Hollywood. We have food grocery delivery for about 75 of our patients. And they actually get the food delivered weekly in conjunction with a group session with our dietitian, and that's been virtual for the last year. And it's just been a great collaboration with Low Country Food Bank. We've also extended it across, and we look to continue to extend it to our different community health centers. And then in regards to test vaccinations, we are partnering with Representative Clyburn. We will have a vaccination event in conjunction with this town hall meeting on this Monday at 6 p.m. at Trident Tech.
Great.
That's all I have.
Any questions? Well, thank you for that. I appreciate it. I see Nick Osborne on here. Nick, do you have any updates you would like to share?
Nothing too much, but other than just generally, obviously, we're continuing to respond to sort of the needs of communities in terms of issues around food insecurity. Obviously, as we start to see the removal of different economic stimulus provisions, the implications that that's having on different communities, focusing a lot in terms of issues of equitability in terms of our ability to serve communities, specifically in those communities that are hardest hit and hardest to reach as well. Also, just as was just reported by Aretha around expanding the types of initiatives that we're doing and looking very much at that connectivity between food and health, and how obviously addressing food in isolation of health is not actually going to necessarily address the holistic nature of people's needs and issues associated with their well-being. So obviously continuing to focus on those types of initiatives, and obviously piloting that food for health in a number of in 4 clinic locations, but obviously looking at opportunities to expand and scale that up. At this point in time, also focusing on our capacity building of our agency partners, because obviously at the end of the day, we could not do what we do in the areas that we serve across the 10 counties without our agency partners, of which are around about 260 at this point in time. So continuing to look at opportunities to both recruit new partner agencies to work with, but also opportunities to look at ways and means of scaling up the role that partner agencies play, looking at opportunities for provide, for example, greater fresh produce in the future as well, looking at issues of refrigeration and looking at ways of being able to open services on a more regular basis rather than just, for example, once a month. But generally just continuing to address the needs as we come out of what some may see as victory over COVID, but I think we're obviously looking at the implications that COVID has on a lot of families and neighbors for extending for what is probably at least 12 to 18 months into the future. And we still have a long way to go, not least because of these issues of new variants, but also the deep-rooted COVID has had on some of the resilience and well-being of many communities across our service area.
Thank you. Any questions for Nick Osborne? Susan?
Yeah, not a question. I just wanted to say thank you. Nick, I haven't had a chance to meet you yet, but we at MUSC have run a program, the USDA Summer Feeding Program, through our hospital for the past 6 years. We were one of the first hospitals in the country to implement that program in a hospital setting. And because of COVID, we've had to pivot and not offer it through our cafeterias because of visitor restrictions. And so we were really fortunate to partner with the Low Country Food Bank and really kind of last minute pull together that partnership. And we are right now offering the program at the Summit Medical Pavilion in North Charleston, and serving probably, I think, around 300 to 400 meals per week. And those are just folks who are coming into our clinic, children who are under 18. And we are looking to expand that to Sean Jenkins Children's Hospital in the next couple of weeks, but just have been a fantastic partner. I wanted to thank you.
No, thank you ever so much for your partnership as well. I really greatly appreciate it. We all do here.
Very good. Thank you, Nick. Appreciate that. And Dr. Andrews, do you have anything?
Yeah, just real quick, nothing specific to my role in the Charleston County Medical Society, but just reiterating what Dr. Richardson pointed out about all of these discussions about the Delta variant and masking decisions and the fact that most of our children under the age of 12 are not vaccinated. So just keeping that in mind as you move forward and making decisions in your personal and professional life. As a pediatrician and a parent of 3 children under that age group, it's definitely a stressful time for us worrying about our kids. And then just totally pivoting an update from Dr. Hink's team in our hospital-based violence intervention program at MUSC. We have hired our staff and we're ready to offer services here in the coming weeks. And the team also was able to submit a large grant to the DOJ for supplemental funding for the program. So lots of great stuff happening on that front.
Great, thank you. Any questions for Dr. Andrews? Joey, did you have anything from United Way that you wanted to share?
Nothing in particular, just ongoing support of our various community partnerships through funding and collaboration with folks like the wonderful food bank, folks, our 2 partner hospital groups, MUSC and Roper, with our Healthy Tri-County initiative, and ongoing work with our school systems. I'm trying to keep our kids healthy, and so that's nothing in particular, just continuing to do what we have been doing.
Great. Thank you, Joey, for all your work. Anybody have questions for Joey? Okay. And Maggie, I know that you spoke a little bit during the community health update. Just didn't want to leave you out if you had any other updates.
Thanks so much. Nothing really specific. Well, 2 quick things. We are, we have received, and y'all may have some prior knowledge about this. We will be receiving what we call ESSER funds. That's the elementary and secondary emergency relief funding. It's part of the American Recovery Act. And our ESSER 3 funds total about $163 million to help school districts and other local education authorities have some relief from COVID-19 impacts. And about 20% of that has to be allocated, at least 20% directly to academic loss. And then the other 80%, there's about 15 allowable activity areas in which those funds can be applied in. To condense those down, they basically could be academic related as it relates to learning supports for students with disabilities, adult education, lower income families, educational technology, all the way to physical building improvements like air quality improvements and things of that sort. So we have been engaging the public in their thoughts and feedback on those 15 allowable activity areas and what they think the top 5 priority areas are. We did a few rounds of engagement earlier in June, both with a focused planning group, so to speak. I wouldn't say planning group, but just a focused engagement group of about 60 individuals over Zoom. And then we've had several community surveys, and there's one still going out. But from the first round, we were able to narrow down the interest across the 15 allowable activity areas to just 6. And so now we are actively soliciting feedback for strategies within those 6 areas on what families think, really could be most impactful to help students. So there is a survey link on our website for that. And then over the next couple of weeks, we'll do some more continued engagement on that and really refining down the ideas that we're getting externally and internally into actionable areas. And then we'll submit a plan by August 24th. So lots of opportunity within that to make a really big impacts, but also sustainable impacts since it's finite amount of funding. So if there's any questions on that or any interest in that, please feel free to reach out. But that survey link is active on our website. Additionally, with that, we have a safe return to in-person instruction plan that we are submitting for next school year. And so we have also solicited some input and feedback on different protocols, such as social distancing masks, plexiglass, things of that sort, in this broader community engagement piece around ESSER, since these are both, the timetables are both tied, even though they're separate pieces. And so we have not made any decisions for next school year as it relates to masks. Most likely all the plexiglass is coming down, except for in certain situations and in certain classroom settings. But that's a case by case basis there. But those are kind of two of the big community engagement pieces that we're working through right now as it relates to next school year, and then those funds that would be used across the next 3 years.
Thank you, Maggie. Any questions for Maggie about Charleston County Schools? Thank you for that report. I appreciate it. Meredith Belinsky, do you have anything that you wanted to share? Okay, anybody else? Did I miss anybody? Susan, go ahead. I'm sorry.
Sorry, I'm wearing a bunch of hats today. I wanted to share an update from the Charleston Healthy Business Challenge. Paul and Joey are also part of our leadership team. We have spent the last couple months updating our website. Thank you, Paul. So we have just gone live last week, and we are preparing to relaunch this program in person. Probably the first couple weeks of August. We will be hosting an event at the Harbor Club, and we'll be engaging with the chamber, and really we continue to partner with the South Carolina Hospital Association to use their strategy for well-being assessment tool that assesses organizational well-being across 11 dimensions of well-being. And we use that for recognition, but we also have developed another track for recognition that is kind of a lighter version, which allows folks to be recognized as a Charleston healthy business. And that just involves participation and at the end of the year, filling out a form that kind of attests to their engagement throughout the year and sharing some of their kind of best strategies. So we're really excited. I wanted to mention that we are actually, the Charleston Healthy Business Challenge and MUSC are sponsoring the South Carolina 7 expedition. I don't know if y'all are familiar with that, but we had done a conservation series earlier this year when we were still doing our seminars remotely. And we had Tom Mulliken, who is the South Carolina Floodwater Commissioner, attend he was a speaker for one of our sessions, and he's leading a 30-day expedition from the mountains to the sea. So he kicked it off on July 1st, and they are working their way down the Palmetto Trail, and will end up in Charleston at the last week in July. And you can participate virtually, or there's a field guide on their website, SC7 Expedition, that you can download, and it tells you exactly where they are every day. So if you want to join the team, on any given day, there are a couple events that are specific to the expedition team, but most are open to the public, or you can plan your own. But really the focus is on bringing awareness to our natural resources, the health benefits of outdoor recreation and nature. And there's certainly some talks around conservation, flood mitigation, things like that. But we are really excited to be able to partner with them, and we would love it if you could share that with your folks as well.
All right, very good. Thank you. Any questions?
No questions. Kevin, I'm sorry, I was driving and I couldn't, by the time I got off mute, I didn't want to interrupt.
Well, great. Thanks, Mary. Go ahead.
I was just saying, Kim and I are hopefully going to talk soon about everything else that's going on with Roper St. Francis, and I'm helping in the other committees as well. I'm actually working with the hospital and through our opioid reduction team, trying to teach a lot of the patients that are coming in for chronic needs and chronic pain care, to help them learn how to use Narcan and we're trying different initiatives trying to help some of these people that are suffering from addiction or that need to go get help as well. And also I'm working with behavioral health a little bit with the Tri-County, but I'm kind of, some of those projects are kind of up and down right now, but it's actually going pretty well.
Okay, great. Thank you, Meredith. I appreciate that. Any questions for Meredith or for Roper Hospital? Okay.
I'll also add in there that our new chief diversity officer started on yesterday. So you guys should start to see Dr. Michael Moxley out in the community a little bit more. And I'll maybe even invite him to some of these meetings so that he can become familiar with the people doing the work.
Great. Thank you, Kim. Appreciate that.
That's right, Kim. July came too quick, didn't it? I heard about this, hearing about this a month or two ago. It's already time.
All right. Did I miss anybody under community update? Anybody else need to report or update us on anything? Okay. Well, if not, I'm happy to see Chloe Stuber on the line with us. And I'm going to ask Chloe if she will give us an update on the city plan.
Thank you. Hi, everyone. I'm Chloe Stuber. I work with the Department of Planning, Preservation, and Sustainability. I'm one of our planners, and our team has been working on revising the city's 10-year comprehensive plan, the last 10 year, and it's before City Council now, but for ultimate adoption. And the city plan is a document that primarily guides the physical environment of the city, so impacting land use and planning decisions. And even though its focus is on the physical environment, there's obviously a lot of social implications. And so we have, thanks to Paul Weider's leadership and other members of this committee who gave input on the plan, there was already a lot of overlap, but we were able to go even further to incorporate the health in all policies approach into the city plan. And so some of the ways in which it's being incorporated is in a sort of housing for all approach, all income levels, life stages, household needs, increasing access to natural resources and parks, addressing food deserts, the access to fresh food and grocery stores, urban agriculture, preserving tree canopy as a way to mitigate heat exposure, increasing mobility, shifting people's modes to more having more infrastructure for pedestrians and cyclists and alternative modes of transport around the city. And then also we have a resiliency element, a resilience and equity element that sort of sums up the entire plan. It's at the end. And social resilience is one of the 4 categories of resilience we explore, and that's defined in the plan as enacting policies that promote health and wellness for all citizens, regardless of age, race, or socioeconomic status. And in the plan, we have a resilience and equity matrix that outlines all of the recommendations throughout the plan that address both resilience and equity. And we have, anytime that there's overlap with policies in line with the health and all policies agenda, we've labeled that, we've named that in the matrix at the end, so you can see where all that overlap is. And so if anybody's interested in looking at the plan and you haven't seen it yet, the website is charlestoncityplan.com. And if you want to see the document itself, it's charlestoncityplan.com/view. And you can view the plan there, and all the appendices are listed on that page as well. I don't know, I don't want to take up too much of your time, but happy to answer any questions folks have.
Any questions for Chloe?
Just want to say thank you so much, Chloe, for the work that you and the other folks on your team at the planning department have done. It makes us, it's very exciting. It makes me very happy to see that health has been called out and has been included in the city plan. And so we really appreciate your work.
Yes, I want to second everything that Joey said. It was great to meet you, and we came to look at the city plan at the Gilliard as a representative team from this committee. And it sounds like you've really taken our ideas and run with them. So thank you so much for doing that. I look forward to looking at it after this meeting.
Same here. Thank you so much, Chloe.
Absolutely. Thanks to you all for your leadership.
Yeah, thank you, Chloe. Appreciate all that you do. And Dr. Johnson, did you have anything further that you wanted to present on that? On anything?
No, I'm just thrilled that we were able to pull this off. Again, I feel like this is such a team effort, and we so appreciate the planning office really embracing what we were trying to accomplish. And I'm just really, really pleased with the outcome.
All right. Well, thank you. Appreciate all the work on this. And let's see. Councilman Mike Seekings, did I miss anything that we needed to cover on here that you can see?
No, I think you've got it well covered. On rare day of quietude over here, but I'll be back. Don't worry.
Okay, great. Well, I know I bounced around a lot, but I think I've hit every agenda item. Paul, did I leave anything out?
No, I think we've covered it. It's just, you don't know how proud and how excited we are to have all of you on our advisory team. We've heard from other cities, and they just are envious of the work that y'all do and how well you work together. And so, again, a big thank you to the leadership of our council members, of the mayor, but especially you on this board that show up to help keep us moving forward. So thank you.
Thank you very much. I ditto to everything Paul said right there. I appreciate everybody's work and all of your time. I know your time's valuable and we appreciate it. So anything further before we adjourn? Okay, well, I'll call this meeting adjourned. Thank you. Hope you have a great day.
Thanks, everyone.
Thanks.
Thanks. Bye.